Tilda, you'll have to forgive me that once again I'm flogging my favourite and most deadest of horses, because the wonderful non-stop drama train that is the female libido drug Agi simply has no brakes. So it's time to jump in to chapter 6 of the Agi saga. And it seems that finally, the mainstream media has actually only just caught up with this story, and Sprout Pharmaceuticals CEO has moved on to something that I can only describe as slightly ironic. So let's dig on into this, shall we? Exactly 1 year to the date after I published my second video in the Agi saga, a further look at Agi and Sprout Pharmaceuticals, a video in which I actually look at the very questionable business practices behind Sprout Pharmaceuticals, and its very blatant AstroTurf organization, Even the Score, which, as you may remember, was the main push group that put all of the pressure on the FDA, shouting that they were a bunch of sexists if they didn't give women their female Viagra, as they called it. Exactly 1 year after this, we find the following article. From nymag.com, the grassroots campaign for female Viagra was actually funded by its manufacturer. Finally, 1 year after I broke this story on YouTube, these guys have finally checked the Even the Score website and found out that one of its major financial contributors was Sprout Pharmaceuticals. Oh, it was going to be so good for women. It was going to bring back our flagging mojos en masse, save slumping relationships, and, if that weren't enough, rectify what some were calling the persistent gender bias at the FDA. The it drug was Agi, Sprout Pharmaceuticals' answer to low libido in women, approved by the FDA last August, and now in the news for its low sales, and for turning out to be a bit of a dud effectiveness-wise. A meta-analysis in April's JAMA International Medicine looked at previously unpublished clinical trials along with those reviewed by the FDA and found that Agi works more like a roofie than a love potion, more than earning its black box warning for causing dizziness, drowsiness, nausea, and, when mixed with alcohol, unconsciousness. All of this for just half an extra sexually satisfying event per month. An industry term that includes everything from actual sex to a randy thought. None of these questions about Agi's effectiveness were hidden during the FDA approval process. It had already been rejected twice. Nonetheless, bringing this drug to market seemed so important a year ago that several well-respected health and women's groups rallied around it as part of the Even the Score campaign, a supposedly grassroots effort to expose gender bias in the FDA as the root of the disparity in treatment options. Men have Viagra and several other sex boosters to choose from, they argued, while women have none. When Agi was approved, organizers called it a win for sexual parity, but some suspected they had been manipulated to score one for Big Pharma, and that troubling changes at the FDA had played a role. It's time to start believing what women say about their sex lives, Jan Erickson, Government Relations Director for the National Organization of Women, said before an advisory panel at the FDA hearing for Agi last year. The crowd cheered her on as if they were at a football game rather than a scientific meeting. The room in Bethesda was packed with Even the Score member organizations, industry-funded doctors, and pharma representatives, along with interested women and their partners, some of whom had been flown in by Sprout. At several points during the meeting, as experts and health advocates presented their concerns about the drug's side effects and lack of efficacy, the crowd hissed. But they applauded other speakers like Laurie Weinstein, who spoke on behalf of the 75,000 members of Jewish Women International, who share our belief that female sexual dysfunction has been overlooked for far too long. We believe the science is there for the approval of the drug. Truly stated like someone who has never read any of the research around Agi. The American College of Nurse Midwives and National Association for Nurse Practitioners in Women's Health and Black Women's Health Imperative joined Even the Score too. The the campaign worked the media so well that Time magazine listed Aggie as the #1 inanimate object that drove the news in 2015. Last August, the FDA delivered its approval, overturning its own internal reviewer's recommendation. In an editorial accompanying the recent JAMA review, Stephen Wallerstein and Lisa Schwartz, physician researchers at Dartmouth Medical School and the founders of pharmaceutical education company InfoFormulary, wrote the FDA administrators overrode scientists' evaluation that the drug did not warrant approval. When we looked at the new data for Aggie, it was hard to understand why the drug was approved the third time around, because there was a new, alarming drug interaction study. So alarming that it was stopped early because so many people had low blood pressure or fainted, Schwartz said. Then, within 2 days of Aggie's approval, Sprout turned a $1 billion profit by selling the company to pharmaceutical company Valeant. It's not unusual for pharmaceutical lobbyists to show up at the FDA, but in this case, they'd been lobbying women's organizations too, convincing some mainstream groups to go to bat for Aggie on the grounds of women's equality, even if it wasn't obviously good for women's bodies. Even the score's leader said the group evolved from discussion among the women's groups, as the New York Times reported. But several organizations we called said the idea had been introduced to them by two close friends, Susan Scanlon, a DC institution when it comes to women's groups, as one activist put it, and Aubrey Shepard, the former head of the Office of Women's Health at the FDA. Shepard especially had feminist health street cred, but in this case, she was working for Sprout. After her tenure at the FDA, Shepard began working closely with pharmaceutical companies, and by 2008 had become a full-time consultant, organizing show-and-tells for device and drug manufacturers to introduce them to the women's health establishment in DC. Products like the female condom, a breast tissue expander for reconstructive surgery, and Plan B. Cindy Pearson, who heads the National Women's Health Network, told us, Shepard often encouraged her clients to make individual contributions to us or our event. In 2013, Shepard was organizing luncheons, conference calls, and private meetings with feminist and medical leaders to introduce them to Sprout's libido drug, then known as flibanserin. At first, those meetings were about the drug's ostensibly promising new data. Aubrey's job was to get people like me interested in a product and to support it. With flibanserin, it wasn't just her job. I believe she thought this drug deserved to be approved, said Diane Zuckerman, director of the National Center for Health Research. But as a scientist, I wasn't impressed with the data. Other feminist health movement leaders echoed the sentiment. So that was quite a large segment to plow on through. However, I believe that it was all very, very relevant and only serves to reinforce what I was stating about a year ago about this drug. As you can see, this drug was very much being put through as basically part of a feminist agenda under the guise of equality. The actual science that will tell you that this drug is not very effective and actively harmful to women be damned. And as we can see here, it appears that not only were certain women's organizations pushing through this, but that this drive to get Aggie onto the market seems to be very much the pet project of this one person in particular. And just as a side note here, to this date I still find it so very interesting and indeed so very amusing that not a single one of the feminist or social justice people here on YouTube saw fit to be covering this drug and telling people how actively harmful it was to women's health. Indeed, not a single one of them has ever mentioned it, despite the fact that this drug was pushed through FDA approval by feminist organizations who were intentionally ignoring the science behind it. By early 2014, Zuckerman and others say Shepard was back knocking on doors with Sprout's CEO, Cindy Whitehead, this time with a different sales pitch. Now there was talk about the need to fight gender bias at the FDA. And this is the turning point. This, if you remember on the Aggie timeline that we were looking at, was the point that the entire sales pitch changed to call the FDA sexist if they don't let this drug through. They raised the argument that led to even the score, said Susan Wood, now director of the Jacobs Institute of Women's Health at George Washington University, who recalled a meeting with several feminist health leaders at which Shepard and Whitehead raised the sexism issue. Wood, a former head of the FDA's Office of Women's Health, says she and others voiced their disagreement with Shepard. This wasn't about the FDA being sexist, it was about the data, says Wood. Wood's group is accustomed to taking positions on health policy and products, but other non-health specific groups that don't normally take positions on particular drugs joined the Even the Score campaign. Board members at the American College of Nurse Midwives, Jewish Women's International, and Black Women's Health Imperative told us they were surprised to learn of their organization's involvement in the pro-AGI campaign. Some said they thought they were supporting a sexual health equity campaign, not a particular drug, and the Midwives College recently rescinded its support. To me, it really looks like we, and probably some of those other organizations, were tricked into being part of something that we were never intending to endorse, one board member told us. Scallon and Shepard both declined to comment for this article. I can't help but think that this might be a little bit of a weaseling out of responsibility here. But if not, then this is a very striking and sad indictment for these sorts of organizations, that they ever so blindly supported something purely because it was being framed as a for equality or an anti-sexism argument without looking at any of the data behind it. And this is, I suppose, yet another data point, or nail in the coffin, I suppose, that shows that when it comes to women's rights organizations and feminist organizations, all you need to do is tell them that this is for equality and you are fighting sexism. They will immediately not look at any of the information you have and simply blindly nod their heads along with your campaign. In June, a paper by a bioethicist and social psychologist in the Journal of Medical Ethics argued that Even the Score was cleverly disguised as a campaign to empower women, based on deceitful and inaccurate information that employed an unethical use of moral arguments. I'm sure you'll remember a few of those from those absolutely god-awful Even the Score adverts that they created.
If you're having trouble getting a boner, and you'd like to have a boner, call your doctor, and maybe he can help you get one. Your lady will thank you. What the f***? Are we really so far behind that we don't think women have the right to sexual desire? Yet again, we come second. I'm a beautiful woman, laying in a bed, talking about your erection. Erection. Now that they're distracted, let's do something to change this. Women deserve better. Let's even the score.
So now that we've got a little bit more info on the backstory of Sprout Pharmaceuticals and AGI, and how it absolutely was pushed through FDA approval by feminist and women's rights organizations, a fact that I'm still amazed not a single one of YouTube's feminist army has talked about. And now that AGI, having been bought by Valiant Pharmaceuticals, has basically been run into the ground by Valiant Pharmaceuticals' various legal problems, what with its price-hiking scandals and all, what exactly has Sprout Pharmaceuticals' CEO, Cindy Whitehead, been up to? After all, what can this woman do? She had a drug that was a complete and utter failure. She had to play the sexism card to get it through FDA approval onto a market where it has completely and utterly bombed, but at least she got $1 billion out of Valiant Pharmaceuticals, so I wonder where she's going these days. Well, apparently Whitehall is back with a new venture. For those that have followed her 22-long career in pharmaceuticals, the nature of her new company may be a surprise, though the through line from her work on AGI is clear. Called The Pink Ceiling, a fitting name given Whitehall's signature hot pink lipstick and clothing, the new company is something of a cross between a VC fund, an incubator, and a consulting firm. Whitehead says that the company will partner with startups that provide products or services to women, helping the fledgling businesses come to market and scale. She expects the Pink Ceiling to invest in some, but not all, of the companies it works with. for those that she doesn't put money into, Whitehead will charge for her services. Because someone who oversaw a company that had a drug that was a complete failure, that had to use political manipulation and the known clout of feminism in politics to force it to market where it failed horribly, is absolutely someone who you want to be getting advice from. But the fun doesn't stop there. The company's first partner is Undercover Colors, a Raleigh, NC-based company that is developing nail polish intended to help wearers detect the presence of date rape drugs. The startup says its polish will change color when it comes into contact with ketamine, ecstasy, Rohypnol, or GHB. In theory, the product should allow a woman to dunk her nail into a drink and immediately know whether it's been spiked. The Pink Ceiling is an investor in the Undercover Colors, though Whitehead declines to specify the size of that investment. Now, there is a sweet irony to this. In fact, there's several layers of it. It's like an irony onion. This woman, whose drug, when combined with a moderate amount of alcohol, will knock someone out. Maybe she's looking to hijack this product and turn it into nail polish that detects alcohol, so that you can know when you're on Aggie. You just dip your nail in there to know if someone's put a shot of vodka in your fruit juice, because that would knock you out. I suppose another point of humour here is that the students who developed this nail varnish that detects date rape drugs, first of all, they're all men, and their product actually works. And second of all, Miss Whitehead has put her support behind a team of men whom feminism has basically declared to be a bunch of rape apologists. Because as we all know from the feminist standpoint here, whilst Undercover Colors' initiative is well-meaning on the whole, Rape Crisis does not endorse or promote such a product or anything similar. This is for 3 reasons. It implies that it's the woman's fault and assumes responsibility on her behalf, and detracts from the real issues that arise from sexual violence. Because encouraging a woman to defend herself is rape apology. Because feminist logic. And of course, Jessica Valenti weighed in on this, saying, prevention tips or products that focus on what women do or wear aren't just ineffective, they leave room for victim blaming when those steps aren't taken. Because once again, if a woman could have done anything to protect herself and doesn't, that means it's her fault when she's a victim. This is what feminists actually think. Whitehall says that she reached out to the Undercover Colors founders after reading the early press on the company, some of which has been quite critical, alleging that such products imply that the responsibility for protecting themselves against sexual assault should be borne by women. I understand how misunderstandings can become truths, says Whitehead, referring to some of the negative media coverage of Aggie. I think you mean, Miss Whitehead, I understand how the truth can come out. I think that's what you meant to say. I asked them, how can I help? She was drawn to the idea of a product that could become a real solution to a real problem faced by women. This was in regards to the Undercover Colors project. Unfortunately, Miss Whitehead, I think you might be backing yet another duff cause. Not so much the Undercover's color product, because that's actually been demonstrated to work, which I'm sure must be a delightful surprise for you, actually working with a product that does what it says it's going to do. However, is drug spiking a real problem? Well, looking at a paper of the toxicological findings in cases of alleged drug-facilitated sexual assault in the United Kingdom over a 3-year period, from January 2000 to December 2002. This paper looked at the toxicology results from 1,014 cases of claimed drug-facilitated sexual assault, analysed at the Forensic Science Service London Laboratory. Alcohol alone, or with an illicit substance and/or medicinal drug, was detected in 470 of all of the cases, 46%. Illicit drugs were detected in 344 cases, which was 34%, with cannabis being the most common, detected at 26%, followed by cocaine at 11%. In only 21 cases, 2%, a sedative or disinhibiting drug was detected, which had not been admitted, and could therefore actually have been an instance of deliberate spiking. This included 3 cases in which complainants were allegedly given ecstasy without their knowledge. Other drugs detected included GHB and benzodiazepine drugs, diazepam and temazepam. And then there was another 9 cases, or 1%, involved the complainant being either given or forced to ingest pharmaceutical tablets or an illicit drug. So even if we're super generous and we take all of those cases together and say they were definitely spiking, that gives us 3% or 30 cases. Out of 1,014 cases, 3% of them at maximum, and that is a very generous 3%, could have been drink spiking. So that's just over 1,000 people who claim that they were drugged, and a maximum of 3% could have possibly been spiked. But let's just look at another study here, shall we, as well, just for fun. A study of patients presenting to an emergency department having had a drink spiked. And this one is just looking at one emergency department over a 12-month period to give you an idea of what an A&E might typically deal with within a year. 75 patients attended with alleged drink spiking over the period of 12 months. 42 samples were analysed and tested positive for drugs of misuse in 8 or 19% of the cases. 65% of those tested had alcohol concentrations greater than 160 mg%. The alleged spiking took place in 23 different locations, with 2 locations accounting for 31% of responses. Only 14% of those questions had informed the police. And it should be noted that this study is done as a follow-up to the one which we just read, because in this one's introduction, it's even referenced in a UK study of more than 1,000 women who claim to have been drugged. 2% were identified as spikes, and then you had the 46 for drugs and alcohol and 34% for alcohol. So this is somewhat a follow-up study only in one hospital to see if those numbers bear out. So a total of 75 patients presented during the 12-month period. 68% of them were female, and females outnumbered males in every age group. Unsurprisingly, most of those patients, 82%, were attendant on the weekend, with the majority of that being between 10 p.m. and 3 a.m. After being seen by the doctor, 66 of the patients were discharged from the department, 6 were admitted, and 3 self-discharged before assessment. The 6 patients were admitted because of the degree of intoxication or agitation, social reasoning, and 1 for vaginal bleeding. A total of 42 urine samples were obtained and analysed, which was 56% of the group, and tested positive for drugs of misuse in only 8 cases, 19%. Not one of them tested positive for Rohypnol or GHB. A total of 34 blood samples were obtained and analysed for the presence of alcohol, with a limit of detection of 10 mg per deciliter, and tested positive in 32, which is 94% of the cases. The results confirmed that a large number of those tested had a high blood alcohol level. It also shows that the patients who tested positive for drugs of misuse had alcohol levels distributed across the range, all except 1 patient admitted to having drunk alcohol before the attendance. A total of 49 or 65% of the patients completed a telephone questionnaire, which was done as a follow-up. The alleged spiking took place in 23 different places. Only 4 places were mentioned on more than 2 occasions, with 2 nightclubs being mentioned 8 or 7 times each. The 8 patients with positive results gave 7 different locations at which the spiking took place, and 5 patients had friends who had allegedly been spiked at the same time, but had not attended the A&E. So I'd like you to note here that out of all of the patients who have been tested here, 8, only 8, have come up positive for any sort of drug. And the drugs used, patients 1, 2, 3, and 4, all of them were amphetamine users, with patient 1 also taking cocaine. Patients 5, 6, and 7 all on opiates, either morphine or codeine, and patient 8 was on cocaine. Given the forms that these drugs take in order to be ingested, it's a reasonable bet that these were all self-administered and used recreationally. So it should come as no surprise to anyone that the conclusion of this is a recent study made by the Regional Laboratory of Toxicology at Birmingham reported an increasing number of requests received for toxicological analysis of individuals presenting to their general practitioner or hospital after self-reported or suspected surreptitious drug administration. Of the 169 samples analysed between 2002 and 2004, only 73, 43% tested positive for drugs or alcohol, with 29 testing positive for alcohol alone. Where drugs were detected, the most involved common drugs of misuse. Neither GHB nor flunitrazepam was detected in the samples analyzed. The results of our study also show that most patients presenting to the emergency department claiming that their drink have been spiked will test negatively for drugs of misuse. Our study showed a much higher detection rate of alcohol, which is likely owing to the timing of the sample taken. The patient's symptoms may well have been the result of excess alcohol. A number of those patients probably had their drinks spiked with alcohol, but this is difficult to determine. Claiming that their drink had been spiked may also be used as an excuse by patients who had become incapacitated after the voluntary consumption of excess alcohol. In other words, drunk people looking for a way to excuse their drunkenness. So, two studies there, one considerably larger than the other, but the second one just a kind of fun little follow-up from the first. As we can see, most people who claim that they're being spiked actually aren't. They're just drunk. And it's interesting that in the first study they were all women, and in the second study more women than men. So based on these bits of information, it would appear that actually there's a lot of women out there who will lie about having their drinks spiked when they weren't, which is possibly going to cause some interesting happenings in the future for this company, whose nail varnish is designed to detect date rape drugs in drinks. And all of that, your product doesn't work, I was totally spiked and not just drunk off my arse, honest, backlash. Have fun with that. So back onto AGI, its former CEO Cindy Whitehead, and the pink ceiling. Let's see if we can just quickly remember all of the pitfalls of AGI, shall we? It was pushed through the FDA approval under cries of, "You're sexist if you don't give this to women." It was repeatedly falsely compared to Viagra, even though its mechanism is completely different because it changes your brain chemistry as opposed to just increasing your blood flow. Sprout Pharmaceuticals paid other organizations to pressure the FDA while also playing the sexism card. AGI was tested mostly on men in a few of its studies, as opposed to women. It had adverse effects in 75% of the people who were actually able to stay in the studies. It produced 1/2 to 1 more sexually satisfying experience per month. It was bought by Valeant Pharmaceuticals for $1 billion, because Valeant Pharmaceuticals hoped that it would dig them out of a very deep legal hole, because at the time they were undergoing federal investigation for their price hiking scandals. In order to cover the bill, Valeant then hiked the price of AGI, so there's an ineffective drug on the market that only got there because of claims of sexism. It now costs, I believe it was about $800 or $900 for a prescription. It doesn't work, it's more likely to knock you out than improve your sex life. It interacts very badly and questionably with the contraceptive pill, often rendering it useless. I think that's most of it, just off the top of my head. So how is Cindy Whitehall billing the pink ceiling? We have a track record of bringing solutions to market that break through for women. Now we want to help you do the same. Led by serial entrepreneur Cindy Whitehead, our team will roll up its sleeves and work as an extension of yours. Whether you are in need of a go-to market strategy or an investment to help get you there, make a pink pitch today. Oh yes, that track record of solutions that break through the market for women by giving them a drug that's basically useless, if not downright dangerous, and fully supported by feminism, because equality. All I can say is good luck to those 4 guys who developed that nail polish for undercover colors. With Cindy Whitehead, CEO of Sprout Pharmaceuticals and one of the developers of AGI, helping you guys out, I can't possibly see how you could fail. What could possibly go wrong?